Hi everyone, today we are going to look at how to do a crown preparation for tooth 1-3. Before starting any prep, I would really recommend taking a moment to look closely at the tooth's anatomy. This comes naturally with practice, but it's a great habit to build early on. Now, as you can see, I'm using a perio probe here. This is the Nordent perio probe, the same one provided in the exam. Use your perio probe to visually mark a line where you want your margin to be. This is your first important criteria, the position of the margin, which should be 0.5 millimeter above the gingiva. That's really crucial. Now notice the occlusal shape and on the palatal side, this cingulum, which many people find tricky but don't overthink it, just maintain its natural contour. And the two depressions, again, you don't need to make them overly prominent, simply reduce following the natural shape of the tooth. Alright, so now let's get started. I've already got a putty here. Check that there are no gaps and that the putty feels stable and secure before you start the preparation. We've got a long straight fissure burr with a blue band. The first step is to create our buccal margin. As you probably already know, the ideal reduction for the buccal margin is 1.2 to 1.5 millimeters. However, what I usually do is start with about 1 millimeter. The reason for that is we'll come back and refine it at the end once the rest of the preparation is complete. That's our buccal margin done, and now we will move on to our palatal margin. For the palatal margin, I'm using the same burr as before. You can also use a needle burr, whichever you're more comfortable with, right? Now the most important step here to prevent undercuts is your burr angulation. A simple trick to remember during crown preps is your burr should always stay in contact with the tooth surface. Alright, now if you look at the angulation of my burr here, I'll be using the straight fissure burr, keeping it parallel to the long axis of the tooth. For the palatal reduction, the margins, we will go for about 0.7 to 0.8 millimeters, but less than 1 millimeter. Alright, now this is your palatal margin done. The next step is our occlusal reduction. Now with canines, this step is quite simple. You just need to follow the natural contour of the tooth. The minimum reduction required is 2 millimeters, but ideally we'll stay between 2 and 2.5 millimeter, which is kind of an accurate clearance, not too over or under. Alright, which gives us a right thickness for our crown. The next step is our second plane reduction. Here I am using a green chamfer burr, which is the one provided in the exam. I like using this burr because it gives really a nice and a smooth finish. However, if you feel there is a risk of over reduction, you can also use your long straight fissure blue band burr instead, whichever gives you more control. I am also checking with my putty just to make sure that we have good reduction. And now continue to do your second plane. That's how your buccal wall is looking now after your second plane and your first plane reduction. Let's move on to the palatal wall now. Here we'll switch to a rugby ball burr or the footy burr. As I mentioned earlier, you will notice there are two shallow depressions along the palatal surface. Just reduce these evenly along the palatal wall. Now take your needle burr. If you look closely, you'll notice there is still one part of the palatal surface we haven't touched yet, which is the cingulum, right? So now we'll go ahead and remove that area. Just angulate your burr slightly to match the natural contour and reduce that remaining surface. This will help the cingulum blend smoothly into the palatal wall and maintain the anatomy. We'll check with our putty again, and if you can see, there is a nice reduction on your buccal, palatal and occlusal. We will move on to our interproximal reduction. Whenever you're working on the mesial and distal sides, it's always best to take a reference from your adjacent teeth. Angulate your burr accordingly to match that reference and then use the same angulation when you move from the mesial to the distal. Here I'm using a needle burr first just to gain the clearance, proximal clearance, and then break the contact. Once the contact is cleared, we'll switch to our long straight fissure burr to prepare the actual mesial and the distal walls. Now, if you can see, you have already got a bit of the taper along the tooth surface, which is really good. Now that we have got our proximal clearance done, let's go ahead and smoothen and refine all our walls. I'm switching back to my long straight fissure burr, as you can see, to make sure all margins are even and continuous, which is a part of our criteria. Always keep your burr parallel to the long axis of the tooth, which is really important to maintain proper taper and avoid undercuts. We will do the same thing all around the prep. Now this is how our prep is looking so far. After we have broken the proximal walls, I have also used an enamel hatchet to remove those thin enamel layers. It's always best to use an enamel hatchet for this step because it gives you more control and helps protect the adjacent teeth from damage. Okay. Now comes the hard part, which is refining the prep. This step can actually take longer than the preparation itself, as this is where we make sure all our measurements are accurate. So take your putty again and start checking. Look at your buccal palatal directions, your margin width and your overall clearance. Make sure everything is within the ideal range because that's where most of your marks come from. Usually we try our best to end up in satisfactory criteria, right? So as you're also refining, gently smoothen out any rough or sharp line angles. The smoother and more even your finish, the better your provisional will be. Now that we have smoothened all the line angles and refined our margins, there are a few different ways you can do this. You can use your enamel hatchet or your green chamfer burr. You can also use your burr inactively for light polishing and finishing touches, enhance, discs, whatever you are comfortable with. Now there are a few simple tricks to get that polish and smooth finish. So if you'd like to see that in detail, please let me know in the comments. I will make a short separate video just on polishing and refining tips. And here it is, our final crown preparation. Now remember, it's not about making it look perfect or pretty. What really matters is that your measurements are correct and your taper is consistent and your prep is clinically sound, something you would confidently do for a real patient receiving a temporary and a permanent crown. So that's it for today's video. If you found this helpful or have any questions, feel free to comment below and I'll see you in the next one. Bye.